Good afternoon. I'd like to call the Finance, Ways, and Means Committee to order for March 23rd, 2021. Mr. Clerk, would you please call the roll?
Representatives Campbell, Camper, Crawford, Faison, Freeman, Gantz, Garrett, Gillespie, Hawk, Hicks, Lamar, Lamberth, Lynn, Miller, Ogles, Sexton, Shaw, Sparks, Todd, Whitson, Williams, Wendell, Zachary, Vice Chairman Baum, Chairman Hazelwood. Madam Chairman, you have a quorum.
Thank you, Mr. Clerk. Do we have any personal orders or announcements before we begin our business? Seeing none, we have 17 bills on our calendar today, and that will be followed by an expansion request hearing from the Department of Mental Health and Substance Abuse Services. So we're going to go through the calendar, and first item on our calendar is HB 742 by Leader Lamberth. Leader Lamberth, you're recognized. We have a motion and a second.
Thank you, Madam Chairman. And there's an amendment that makes the bill. It should be amendment coded 5882.
Hold on just a
Madam
minute,
Chairman,
Leader.
there's one more recent amendment, 6073. There was a clerical error. Neglected that we need the newer of the amendment. The staff had told me that just beforehand. 6073 is the amendment code. I
Okay.
apologize.
Good, because that's the amendment I have. All right, so we have a motion and a second on amendment drafting code 6073. All those in favor, please signify by saying aye. Any opposed? Ayes have it. The amendment is hereby attached to the bill. Leader Lamberth, would you like to describe the bill as amended?
Thank you, Madam Chairman. And this is the bill that would allow for our wineries to still utilize third-party shippers for their shipments of wine to both individuals within Tennessee and outside of, and for other wineries outside of Tennessee to continue to ship into Tennessee using these fulfillment centers. It will make sure that they are licensed and subject to inspection by the ABC. And the reason why we had an updated amendment between sub and full, I'd stated in the subcommittee, there were a couple of words that were left out, or farm winery. Farm winery has a very specific definition and is a separate entity from your regular wineries. And so we made sure in Amendment Code 6073 that the words "or farm winery" are included after the word winery in several instances. That's what the bill does, Madam Chairman.
Thank you. Are there questions on the bill? Questions have been called. Are there objections? Seeing none, we're voting on House Bill 742. All those in favor, please signify by saying aye.
Aye.
Any opposed? The ayes have it. House Bill 742 moves on to calendar and rules.
Thank you, Madam Chairman, members of the committee.
Item 2 on our calendar is House Bill 820 by Chairman Holtzclaw. We have a motion and a second, but I don't see Chairman Holtzclaw. So we're missing an important component. We'll roll this to the Hill. Item number 3, House Bill 719 by Chairman Faison.
Motion on the bill.
We have a motion, we have a second.
What are you laughing about? Motion my bill. Members, I can get really deep and read you this whole page, but I'm gonna tell you this bill is really simple. It designates ambulance services as an essential service. I mean, I'll go as deep as y'all want me to go.
Are there questions for Chairman Faison?
Hey.
Previous question has been called. Any objection? Seeing none, we're voting on House Bill 719. All those in favor, please signify by saying aye. Any opposed? The ayes have it. House Bill 719 moves on to calendar and rules. Item number 4 on our calendar, House Bill 235 by Chairman Littleton. Chairman Littleton is with us, and you are recognized. We have a motion and a second. Chairman Littleton, if you'd like to explain your bill, please.
Yes, thank you, Chair Lady. This increases from $10,000 to $25,000 the threshold for which a local board of education or a governing body of the public charter school must make purchases or expenditures by competitive bids if an LEA chooses not to follow the local governing body's purchasing procedures. And it establishes that counties that have adopted the County Financial Management System of 1981, the County Purchasing Law of 1957, or that are similarly centralized for purchasing are deemed to have full-time purchasing agent and authorized to increase the competitive bid threshold to $25,000 under certain conditions.
You've heard the explanation. Are there questions? Seeing none, Representative Sparks.
Representative, where is the checks and balances on this with up to 25,000? Is this consistent with what the public school is doing? Because this is for charters, right?
Representative Littleton.
It's for both.
It's for both?
It is.
Okay.
Mhm.
So they're still putting this out, public notice, RFP, correct?
Chairman Littleton.
Actually, they can make phone calls under the 10,000 now, so they'll be able to make 3 bids by phone with this.
I mean, is there a public notice out there?
Chairman Littleton.
No.
There's not. Okay, thank you.
Leader Camper, did you have a question?
Thank you, Madam Chair. He asked my question.
All right. And Chairman Littleton, I believe that what we're doing here is just with inflation and the cost, what formerly would have cost $10,000 or less, those prices are now greater than that. So there's not as much opportunity to use this process. And it's simply kind of speed things up. Chairman Littleton.
In 2005, they changed the bid from, it was 5,000. In 2010, they raised it to 10,000, and it hasn't been changed since then. So yes, you're correct.
All right. Are there any further questions for Chairman Littleton? Seeing none, we're voting on House Bill 235. All those in favor, please signify by saying aye. Aye. Any opposed? If you'd like to be recorded as a no, please see the clerk. But House Bill 235 passes to calendar and rules. Thank you,
Thank you,
Chairman
Chair, Lady,
Littleton.
and Committee.
Sorry. The next item on our agenda, item 5, the sponsor is asked to roll that for 1 week without objection. 539 is rolled 1 week. Item number 6 on our calendar is House Bill 183 by Chairman Ramsey. We have a motion and a second. Chairman Ramsey, you're recognized.
And thank you, Lady Chairman, ladies and gentlemen. This bill essentially does one thing. It creates the Professional Art Therapist Advisory Committee that's within the Board of Examiners for Psychology, and it creates a license in the state of Tennessee for a licensed professional art therapist. So as you can see, it has a positive physical note, and so with the pending further questions, I'll allow you to ask whatever you need to ask.
All right, you've heard the explanation from Chairman Ramsey. Are there questions? Leader Lamberth.
Move previous question.
We have a motion for previous we have a previous question has been called. Any objection? Seeing none, we're voting on House Bill 183. All those in favor, please signify by saying aye. Aye. Any opposed? Ayes have it. House Bill 183 goes to calendar and rules.
Thank you, ladies
Thank you,
and
Chairman
gentlemen.
Ramsey. Yes. Representative Shaw.
I don't think that sponsor was going to let us talk anyway. You notice he said, I will allow you to ask questions.
I'm sure he would have graciously acceded to questions had they been asked. Item number 7. Item number 7 is Chairman Vaughn's. He is not with us at the moment. We'll roll this to the hill. Item number 8 on our calendar, House Bill 205, is by Representative Cochran. Thank you for being with us.
Yes, ma'am.
We have a motion and a second. Would you like to explain your bill to us, please?
Yes, ma'am. Thank you, Madam Chairman. House Bill 205, it addresses really an obscure type of utility district. It's one that is owned by one or more counties. And my mic was off. My bad. Daggum. So basically, this brings up their compensation level to municipal utility districts. But we'll pause with any questions.
Are there questions? Representative Miller.
Thank you, Madam Chair. This will increase from $100 per month to $300 per month. Is it permissive?
It is.
So the
Representative Miller.
local county would have to vote for this or put it in place?
Representative Cochran.
Thank you, Madam Chair. The local utility district would vote. So it's a separate body. It really doesn't involve the county government, but the utility itself is owned by the county, similar to a municipal utility district, but they have their own board. They would vote on that compensation.
Representative Miller.
So the next time, let's say they want an increase in salary, would you have to come back before the legislature to allow that?
Representative Cochran.
Yes, sir. Absolutely. If it went above that 300, absolutely. You would have to have legislative approval.
Thank you.
Are there additional questions? Seeing none, we're voting on House Bill 205. All those in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 205 moves to calendar and rules.
Thank you, Chair, Lady, and Committee.
The next item on our agenda is House Bill 212, and I do see Representative Clemens is with us. We have a motion and a second. Representative Clemens, you're recognized.
Thank you, Madam Chair. This bill is the Stop the Bleed bill that came to me from the trauma surgeons at Vanderbilt University Hospital and from other trauma centers across the state of Tennessee. It's in furtherance of their national Stop the Bleed program and authorizes LEAs and schools to place Stop the Bleed kits in classrooms, has permissive local fiscal note.
You've heard the explanation, members. Are there questions? Chairman Zachary.
Thank you, Madam Chair. Sponsor, can you tell us what is in a bleed control kit? Can you describe that, please?
On
Representative
section
Clemens.
1, sub A, it outlines it: 1 tourniquet, 1 compression bandage, 1 bleeding control bandage, protective gloves, 1 marker, scissors, instructional materials developed by the U.S. Department of Homeland Security as part of the department's Stop the Bleed campaign, and bleeding control materials developed by the American College of Surgeons, Committee on Trauma. I usually have a kit, but we're not allowed to have props, so it's in my office.
Chairman Todd.
Thank you, Madam Chair.
Thank you, Madam Chair. I noticed this provides some civil immunity in this bill. Can you give me a description of that? Because I know we've talked many times before about making sure folks have access to the court system for things that are wrong and negligence and other things like that. So can you address that, please?
Yeah, it was requested to be inserted in there by this body when I first introduced this bill 3 years ago. And what it is it policy generally wants to incentivize people to be a good Samaritan. And in this instance, if a teacher, a nurse, or somebody like that was attempting to be a good Samaritan and stop a traumatic bleeding event in a classroom and save a child's life, then we don't want, we want to provide that immunity.
Further questions, Chairman Todd?
Thank you for that explanation. I would certainly tend to agree. Thank you.
Are there further questions? Seeing none. Question has been called. We're voting on House Bill 212. All those in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 212 moves on to calendar and rules.
Thank you.
Thank you. Item number 10 on our calendar is House Bill 626 by Representative Hicks. We have a motion and a second. We have a clean mic. So Representative Hicks, you want to explain your bill?
Thank you, Madam Chair. Thank you, committee. House Bill 626 assures that our state departments will coordinate wraparound services for pregnant women and/or women with small children that are seeking treatment from addiction. This bill has no positive, or it's a positive physical note, and it's federal dollars that comes through the state.
We have a question has been called on the bill. Is there any objection to calling the question? Seeing done, we're voting on House Bill 626. All in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 626 moves on to calendar and rules.
Thank you, Madam Chair. Thank you, committee.
Thank you for bringing the bill. Item number 11 on our calendar is House Bill 339 by Representative Jernigan. We have a motion and a second. Representative Jernigan, if you can explain to us what this legislation would do.
Madam Chair, I'd be happy to. Members, Robin Hospitality owns the Wild Horse Saloon, General Jackson Showboat, and the Gaylord Springs Links in mine and Representative Beck's districts. These properties are under management agreement with Marriott International. This bill does three things. The Wild Horse Saloon will pay a higher limited restaurant service fee. Number two, it designates the General Jackson Showboat as a paddle wheel steamboat company and will allow alcoholic beverages served in the dock area. And last, it will allow the ABC to grant a liquor license franchise to a management company, which in this case is Marriott International. Madam Chair, I'm happy to answer any questions.
Having heard the explanation, do we have questions? Question has been called on the bill. All those in favor of House Bill 339 moving on to calendar and rules, please signify by saying aye. Aye. Any opposed? No. The ayes have it. If you'd like to be recorded as a no, please see the clerk.
Thank you, Madam Chair. Members.
Thank you. We're now on item 12 without objection. The sponsor has asked to roll that 1 week. Seeing no objection, we'll roll that to our next week's calendar. Item number 13 on our calendar, House Bill 674 by Representative Freeman. We have a motion and a second. Representative Freeman, you're recognized.
Thank you, Madam Chair. I do have an amendment. Do I have to put it on here as well?
That amendment is traveling with the bill.
Fantastic. Thank you. So this bill creates a new type of liquor by the drink called license called a food hall for Assembly Hall at 5th and Broad. The Assembly Hall is 110,000 square feet over multiple levels, featuring 20 some odd restaurants. Worked extensively with the ABC and believed that this legislation is the best way to resolve a number of legal issues that present this food hall from operating under a traditional restaurant license. A couple of different things about that is they operate under one main license, which can simplify inventory control. The beverages can be carried freely between the multiple venues, and it creates a process for the ABC to approve and regulate individual eateries. And with that, I ask for your approval.
You've heard the explanation. Are there questions for the representative? Seeing none, we're voting on House Bill 674. All those in favor, please signify by saying aye. Aye. Any opposed? No. If you'd like to be recorded as a no, please see the clerk, but the ayes have it. And House Bill 674 moves on to calendar and rules. We have item 7 on our agenda. We're going to go back and pick that up since Chairman Vaughn is now with us. We have a motion and a second. Chairman Vaughn, you're recognized.
Thank you, Madam Chair. Pleasure to be with you all here this afternoon. I don't think General Jackson Showboat, but nonetheless, we do deal with the mundane. But this bill that we're presenting today actually streamlines the private detective, lie detector, and the alarm systems commissions. We're doing away with those boards. They will all funnel in together and be run in a commissioner-led program that's run by the Commerce and Insurance Commissioner. And it's a streamlining and doing away with boards for these three areas.
We're making government work better.
I believe we are, Madam.
Are, are there any questions of the sponsor? All those who'd like to make government work better, please signify by saying aye. Any opposed? House Bill 781 moves on to calendar and rules.
Thank you. And I even feel better about myself now.
We're now back on item 14 on our calendar, House Bill 517 by Leader Gant.
Thank you, Mr. Chairman. This bill was brought to me by the mayor of Fayette County and
We
the
have a
chairman
motion
of
and
the
a
Chickasaw
second.
Basin Authority. In a recent sunset review of the Chickasaw Basin Authority, it was questioned whether Fayette County should be a member of this board despite Fayette County's participation for the last 30 years. This bill clarifies that should a county desire to be part of the Chickasaw Basin Authority, the county legislative body must first express its desire to participate by resolution, then be approved by the Chickasaw Basin Authority Board of Commissioners.
You've heard the explanation for the bill. Are there questions? Question has been called. All those any objection? Seeing none. All those in favor of House Bill 517, moving on to calendar and rules, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 517 moves to calendar and rules. Next item on our agenda is also by Leader Gant, House Bill 776. Leader Gant, you're recognized.
Thank you, Chairman.
We have a
currently-
motion and a second, and we do have an amendment on this bill, I believe, Leader Gant.
Second.
Yeah, the amendment makes the bill.
And the drafting code on that amendment is, I'm showing 4919. Is that what you have?
That is correct.
All right, so we have a motion and a second on the amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The amendment passes, and we're now on the bill as amended.
Thank you, Madam Chair. Currently, business relief payments issued by the state using coronavirus relief or other CARES Act funds may be treated as taxable income by the federal government. In general, federal taxable income serves as the starting point for determining a business excise tax liability in Tennessee. This legislation provides an excise tax deduction for Tennessee businesses and entities that received an amount through one of these funds.
Question has been called. I would just like to make a comment. I thank you for bringing this. I think it's important that we don't tax these businesses on funds that they obviously need to keep up and running. So I appreciate you bringing that. Question has been called. Is there any objection to the question? Seeing none, we're voting on House Bill 776. All those in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 776 moves on to calendar and rules. Next on our agenda is House Bill 767 by Chairman Hawk. Chairman Hawk, you're recognized. We have a motion. We have a second.
Thank
Chairman
you.
Hawk.
Thank you so much, Madam Chair. This is the Tennessee Insurance Modernization Act. The bill does four things. The bill ensures that Tennessee law stays current and consistent with international agreements and is not preempted by federal law. It additionally, with this bill, the department seeks to update and expand Tennessee's captive insurance law to authorize parametric insurance coverage and lower the initial capital requirements for captive sales. Additionally, the bill eliminates an unnecessarily filing from workers' comp insurance carriers and repeals annual reporting requirements that has run its course for them. Lastly, it eliminates the requirement that the commissioner will be named an agent for service or process for insurance division licensees. This will now be performed by the Secretary of State. That's the brief description, Madam Chair and members.
We had a motion and a second, and there are no amendments. So discussion on the bill. Questions for the sponsor? Seeing none. Oh, Leader Camper.
Thank you, Madam Chair. Representative, you mentioned that it would lower the amount for the captive insurance. do you have any idea what that amount is or how much lower, or could you talk to that issue? Oh. He couldn't understand me, Mr. Chair, Madam Chair. I still have.
Yes, Leader Camper, if you could repeat your question, please.
Thank you. I was saying that the sponsor mentioned that it would lower the amount for captive insurance to take advantage of that program. And I'm wondering to what dollar amount was it lowered, or was it like cut in half, or any information he could provide on the captive insurance portion of this bill?
Chairman Hawk.
Thank you, Madam Chair. And Leader Camper, the original bill stated a $250,000 capital investment would have to be made by the company. The amendment that we put on in House Insurance Committee actually lowers that threshold to $100,000 of capital by the company. So it's going to allow several folks to come in. That's just a minimum. There'll be folks with much, much larger capital in this, but it does allow smaller folks to get in this business as well.
Yeah.
Leader Camper.
Thank you, Madam Chair. Yeah, that was the point I was trying to get to, that more smaller captive insurance organizations, companies will be able to access this now.
Chairman Hawk.
And thank you for your question and comment. This is a further attempt to make Tennessee much more attractive to business as they come in, and this is just one more tool in our toolbox, as the cliche goes. So this is helping a great state get even better.
Thank you.
Representative Lamar.
Thank you, Chair Lady. Mine is merely a suggestion. I know that you are taking off, Tennessee has to duplicate the federal government database in this bill about providing information on the suits and everything. So I know that you're going to put a link to the federal website. I would suggest that we also include an infographic to still break that information down so that the common citizen will be able to analyze this federal information just easier. I understand making it simpler by not duplicating it, but maybe include an infographic on a page to support or make that data more readable for the everyday citizen. That's my only suggestion.
Chairman Hawk.
And thank you, Madam Chair. Thank you, Representative. I think that Department of Commerce and Insurance has heard that as has been suggested by you, and I will reinforce that suggestion that you have made. Thank you. Thank you, Madam Chair.
Any additional questions? Seeing none, we're voting on House Bill 767. All in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 767 moves on to calendar and rules. Next on our agenda is House Bill 161 by Chairman Williams. Chairman Williams, you're recognized.
Second.
We have a motion and a second.
Thank you, Chairman and members. House Bill 161 was brought to me by my local city and private act-owned hospital. 21 years ago, the assets and liabilities for TCRS were inadvertently not transferred to the private act hospital when it was formed. This bill would allow for the assets and liabilities to be transferred some 21 years later. I'm happy to answer any questions you might have.
Are there questions? Seeing none, we're voting on House Bill 161. All those in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 161 moves on to calendar and rules. That brings us back to item 2 on our calendar, House Bill 820. Chairman Holtzclaw is now with us. Chairman Holtzclaw, you're recognized.
Thank you, Chair Lady and Committee. Basically, House Bill 820, it's an administration bill brought to me by the Secretary of State. And what it does, it basically streamlines the department, makes it more efficient, and also reduces the charges for charitable things.
And I will note for the members, we do have a funding letter for this from the Secretary of State's office.
It is covered, yes.
Are there questions? Chairman Williams.
Chairman, thank you, Chairman Holtzclaw. I get a lot of contact from charitable folks that try to do these charitable events in the community. And I know one of the biggest concerns they had over the last several years was the cost in order to to have a charitable event was way more expensive than sometimes the money they're able to raise. And so I thank you for bringing this bill. I also want to thank the Secretary of State's office, who is always willing to work with our constituents to make sure that they get their paperwork filed on time and get this done, because it does play an integral role in our local communities and the monies they're able to raise for local nonprofits. Thank you.
I appreciate the comments, and those fees it can run anywhere from $25 up to $500, and it's all down, I think, to $10 now. So that's pretty significant.
Other questions, comments? Again, I know of a number of small charities, and the difference between a $500 fee and a $10 fee will make a big difference to their bottom line. So thanks to you and to the Secretary of State, as Chairman Williams has said. Seeing no other questions, without objection, we're voting on House Bill 820. All those in favor, please signify by saying aye. Any opposed? The ayes have it. House Bill 820 moves on to calendar and rules.
Thank you, committee.
Thank you. That does complete our calendar for today. As stated in the beginning, we do have an expansion request hearing from the Department of Mental Health, and the chairman and her trustee crew are in the house, and we would invite them to come forward. We'll go out of session. And members, on your dashboard, you do have the presentation documents. And Commissioner Williams, we're looking forward to your presentation, because by this point in the day, we all need some pepping up, and we know you can do it.
Well, I'll pep you up because this is a great day. After several of you, including Leader Lamberth, were present for the $250 million trust fund announcement yesterday, you have no idea how excited we are about that, and hoping that will pass the legislature. And we're here before you with my Deputy Commissioner, Matt Yancey, as well as my Director of Legislation and Director of Budget, to talk about this expansion. We have two that have been requested, Madam Chair Hazelwood and distinguished committee. The first one is the system of care expansion. These are funds that we have worked with the Department of Human Services over the last several years so that we could expand what we call the system of care, which actually is a evidence-based, outcomes-oriented system of care for kids and their families that are struggling with mental health concerns. It's been federally funded for multiple years. This would allow us to expand it to other counties. And so we kindly ask for your approval for that, and would answer any questions that you might have about that particular expansion.
Thank you, Chairman Williams. Just if you can tell us or remind us which counties have already been participating, and then will this take it to all 95 counties, or just let us understand how that will work.
Absolutely. Our system of care activities are overseen out of Deputy Commissioner Yancey's area, the community behavioral health area. And what we'll tell you is we have 7 providers. That would be Frontier Health in Upper East, Helen Ross McNabb in Chattanooga, as well as Knoxville, Mental Health Cooperative that's here in Nashville, Pathways that covers the rural West Tennessee counties, Professional Care Services that also covers rural West Tennessee, Tennessee Voices that covers many counties in West, Middle, and East, Volunteer Behavioral Health that covers primarily the rural middle part to Chattanooga. And so this will allow us to add one additional team to each of those areas to cover those counties. And it would allow us to increase from 12 sites to 17 sites, with our hope being able to serve more kids and adults through these programs.
Are there questions of Chairman Williams on this expansion request? Well, no questions. I think everybody, in spite of their countenance. We're excited about this. We truly are, because it means that more families and young people in Tennessee can get the help that they need. So,
Absolutely.
Chairman Hawk.
Thank you, Madam Chair, and Commissioner Williams, thank you so much. Our advocates in the room are very happy about this, and as you listen to those agencies and the folks in the field, they're very happy about this as well. So thank you so much. As it was mentioned, and the governor mentioned yesterday,
Yes, sir.
the mental health investment that we're looking to make in our schools as well. I'm asking of the chair lady as well as yourself, are we going to be able to ask when we get the supplemental appropriation, we'll be able to go in depth on that particular issue?
We'll have those requests in front of us, and we'll be at the will of the committee.
Thank you, Madam Chair. And I guess I was chomping at the bit to ask some questions now. I was going to ask for forgiveness instead of permission, but I'll wait until that time, Madam Chair. Thank you very much.
Madam Chair, if I could say one thing to that, we have a proven track record of doing investment funds and being able to leverage those with public-private dollars. It is our hope that you will look at this as that opportunity. If you look at what you approved back in the year 2000 with the Creating Homes Initiative, you guys gave us $2.5 million. That has grown through leverage dollars to almost $750 million. This is an incredible return on investment. It allows our state to go and be above any other state to say, we've set aside these funds, and just think about the opportunity to get other philanthropic, other foundation dollars to give to this fund that's set aside, and we just give money out to the providers to do more in their school districts. I can't answer any questions other than to say, proven track record, and this really will make an unbelievable difference with our kids across the state.
And there are those of us who would like to give you $2 million and you return 750. So
Hey, I wish I could get a percentage.
we might have to have a big collective to raise the initial $2 million, but that is a great return on investment.
Thank you.
So no additional questions on that issue, but we have a second expansion request. If you'd like to describe that, please.
We sure do. Many of you have heard about the legislation that's been passed in the federal government related to a new phone number that would be dedicated for those that are struggling with suicidal thoughts. It's going to be a number that will be 988, right? Our state has been really fortunate. Again, you guys have funded all of the things that other states need and don't have, which a lot of this funding and this proposal is for. Crisis teams, mobile crisis units, the ability to have a 24/7 response team for crisis. So we're asking you to accept this money that we're being given to create a 988 council to look at what we would do in this state to be able to respond to the 988 legislation that's been passed. It will have multiple stakeholders as part of it to make sure that we get it right. But it truly is just the ability to accept money that's been offered to us and every other state in the union to be able to create a 988 group to be able to see what we'll do in the future.
Are there questions? Commissioner, in the written material.
Yes, ma'am.
That we were hotlines to above 80%. Can you tell us what it is now?
Yes, ma'am. And thank you for asking about that, because that has caused some concern that people think 20% of the calls are getting dropped. They're not. These calls come in to our state, to the providers that currently are doing the National Suicide Hotline. If they can't answer within a certain amount of time, it gets rolled back, correct, Deputy Commissioner? It gets rolled back to the National Suicide Hotline number. So everybody is getting an answer. It's not that they're getting dropped. And right now, our overall rate is at 75% answer call rate.
But the other 25% are answered, just not in Tennessee. Is that what you?
Absolutely.
Okay. Which is, I think, an important point, because I think some of us, when we read that, were, as you said, concerned about what's happening with those other people who are obviously in crisis.
And the other thing I'd add to this is to remember that because we've done so much in this state already, we have another line, the crisis hotline, where we get calls related to suicide ideation, and we take over 130,000 calls through our community behavioral health providers over and above what this is. So that's another important that are answered and responded to.
All right, and I have, just because this is an ongoing, we have these hotlines in place, this 988 number, and this is one-time funding.
Yes, ma'am.
So how will this be funded from the proceeds from the trust fund, or how do we anticipate funding this in future years?
That's part of what the group's going to talk about, because when we put in the response to the request for funding and request for a proposal, we explained that we couldn't commit the state to any dollars, that that would be at the will of our governor and the legislature to decide what to do. This literally is just bringing people together to talk about what do we need to do as 988 rolls out across the country. It hadn't rolled out yet, right? So there's been no funding to do it because it rolls out, is it 2 years, Matt? Thank you, July 2022.
Right, thank you. Are there questions of the commissioner while we have her? Representative Miller.
Thank you, Madam. Commissioner, I'm looking at and reading where the grants will provide funding to 6 NSPL call centers. What type of centers are those and how would they operate?
Yes, sir. Thank you for asking about that. In East Tennessee, that's Frontier, and also we have Oak Ridge that gets these dollars. In Middle Tennessee, Volunteer, Centerstone, and Family and Children's Services. And in West Tennessee, the Memphis Crisis Center will gets these dollars. And this will actually help us with those that are underperforming to get more staff. So part of it's going to be used for that. But the majority of these funds are for this council to come together and look at how our state could best respond to the 988 legislation.
Thank you. Thank you, Commissioner. Thank you, Madam Chair.
Additional questions? Seeing none, Commissioner, thank you.
Thank
It's
you so
always good to have you in front of us. Again, you do pep us up not only with your peppy attitude, but just the positive difference that you and your department bring to a lot of people in Tennessee. You literally
We've got an
save
amazing
lives. So,
team, an amazing
you.
team. So thank you. Thank you, guys.
Without objection, we are now back in session. Chairman Williams, you're recognized.
Thank you, Chair Lady Hazelwood. Just for the members of Appropriations Subcommittee, it's a reminder that at 4:30 today, we will be taking appropriations amendments at a lightning pace. You all will be graded upon your appropriation amendments based upon brevity and succinct request, as well as local, statewide, and regional application. But just want to remind those members to be here. The crack staff will be here early to sign members up on a first come, first served basis. And so I appreciate all of you, and thank you, Chair Lady Hazelwood, for allowing me to make an announcement.
Leader Gant.
Thank you, Madam Chair. Chairman Williams, since I'm already in here, can I be number one on the list now?
Chairman Williams.
The wise representative from the poor part of Williamson County has already requested to be number one.
As those other members of the committee fight for your spot. That does complete our calendar for today. We have any unfinished business or other business to come before the committee? Seeing none, we stand adjourned. Okay.
We are taking no more names.